Sir, we are live now. You can go start.
Meeting is being
हेलो
सर आप पास में बस मत बैठिए वरना इको होगा.
Very good afternoon, all the immense doctors. Thank you so much for joining us today webinar. Our endeavor to spread the awareness about rabies vaccine, which is felt can be avoided once appropriately vaccinated. This is the initiative from Cadila through its innovation to serve the society and humankind. The topic of today webinar is the dosage reduction strategy in rabies management, role of novel vaccine. Dear doctor, the rabies is the world's first novel 3-dose anti-rabies vaccine. With great pride, we would like to inform you that the rabies has successfully completed 1 year of launch, with the more than 40 animal bite victims being vaccinated. 100% compliance was recorded, and no case or ADR was registered. With this, it is my honor to introduce to you the speaker of today's webinar, Mr. Dr. Abhishek Diwan, specialty physician. Now I would like to request Dr. Diwan sir to initiate the talk later. On we have question and answer session. So doctor, please start.
novel. Good afternoon, everybody. I am Dr. Abhishek Diwan from Khanbagh, Sangli, practicing more than 20 years here. Today we are going to see the rabies vaccines, about rabies vaccines. Novel 3-dose G protein vaccine, ultimate key for compliance. Rabies is a public health challenge in India. Globally, 59,000 human deaths annually are done, which is highest in India. In India, India had 20,000 human deaths a year from rabies. According to 60% of the rabies deaths in Asia and 35% of the globally, 91% deaths in India occurred in the rural areas. Right now, current management is local wound treatment, that is, we can call it first aids. Second is active immunization, vaccines, and passive immunization. Current challenge of PEP is non-compliance. Current rabies vaccines are cell-cultured vaccine. And third and most important is inactivated vaccines, which are more than 50 years old technologies. Inconsistency in potency, stability, availability, short supply, adverse events. Compliance anti-rabies vaccines. Compliance is means who receives the full course of anti-rabies vaccine, that is the scheduled dose of anti-rabies vaccines on the recommended dates. Second one is delayed compliance, who completed the scheduled dose of anti-rabies vaccines within 60 days, but deviated from the scheduled regimen, dropout and non-compliant. These are the most chances of dropouts and reason for the deaths. Dropouts who had taken at least one dose of anti-rabies after the exposure or animal bite, but they do not complete a full dose of full schedule of the vaccine. That's why the rabies virus get multiplies and patient go into the complications. Limitations of 4-dose WHO recommendation. Rabies post-exposure prophylaxis in routine practice in the view of new centers for the disease control and prevention and World Health Organization recommendation. The conclusion is patients do not always receive optimal rabies PEP under the real life conditions. Significant proportion of patients did not develop adequate antibody levels after 4 doses of vaccines. A retrospective analysis done at the travel clinic. Non-compliance to 5 dose proven cause of death. The reason of death may be due to lack of administration of rabies immunoglobulins or poor compliance of the vaccines. (53% were non-compliance to the full course of ARV, anti-rabies vaccines. The compliance rate for the intramuscular rabies vaccination was 60%. Compliance to anti-rabies vaccine in post-exposure prophylaxis. At Municipal Corporation Hospital, Bangalore, or any other, 1 dose of rabies vaccine administration intramuscularly on days 0, 3, 7, 14, and 28 as a PEP. Also, major constraints for the compliance to complete the course. Consistency for compliance to complete course of anti-rabies vaccine. Interference with schooling timing, distance of the hospital, cost incurred, forgotten dates. The major constraints for the compliance to complete the anti-rabies vaccine was loss of wages in the 47%. Now we can see evolution of rabies vaccine. From 1885, it was of 31 dose and still it is gone to up to the 5 dose. From 1911, 1976, increase in immunogenicity, each 0.5 ml daily dose, and right now up to the 5 doses. Introducing a novel vaccine with simple and shorter regime. Novel 3-dose recombinant rabies G protein vaccine. First vaccine with 3 dosage, intramuscular regimen 0, 3, and 7. Better compliance due to easy to flow regimen and less visits. Convenience, ready to use, no reconstitution needed. First protein subunit vaccine and prepared by VLP platform technology. Since last year, I have used for the 3 patients and which give more compliance for the patient. It is prepared with VLP technology. Study design of 3 doses. Okay. Clinical study phase 3. This is important. Safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as a simulated post-exposure immunization. A randomized competitor controlled multi-center phase 3 clinical study. Phase 3 study to evaluate immunogenicity and safety of the rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers. Randomized comparative controlled multicentric study. Efficacy and safety results. Efficacy and safety. The result were consist across the different age group and genders. Observed different. Novel 3-dose has a better safety profile as significantly less age compared to reference vaccine. A non-inferiority or seroprotection. Primary end to point day 14 and day 42 we made. Test and comparator identical in seroprotection rate both in day 14 and day 42 rather than day 3. Study conclusion is novel 3-dose was non-inferior to reference vaccine, less adverse effects compared to reference vaccines, and novel 3-dose was found to be safe and immunogenic and was comparable to 5-dose of WHO pre-qualified vaccines. It has a Golden Globe Tiger Awards for the Malaysia. Thank you. Shubh Deepavali.
No, any doctor. Hello. With this honor to introduce the speaker with today's webinar, now I would like to request to our doctors to initiate the talk and later have a question session. Now there is any question from any sir? Hello. Okay, so thank you so much, Dr. Abhishek Diwan sir, for informative talk. We truly appreciate your efforts to last, but not least, I like to inform you that Travis has won 2 prestigious awards, the Innovation category, Indian Pharma Award and Golden Globe Tiger Award. So thanks for joining webinar. Shubh Deepavali sir. Thank you.
Okay, sir. Can I end now, sir?
Yes, yes, yes.
Okay.